Good evening everyone. So let's start, and we was discussing about the KROK2 2018 paper. So let's discuss the 2018 paper. So we already discussed the 25th questions. Now we are going to the 26th question. So in the 26th question, a 16-year-old adolescent living in a rural area has been beaten in the shin, that is the tibia, by a stray dogs. So we discussed that if it is any dog, rabbit or anything, that is like any animal, so it is what it will spread, it will spread the rabies. Now this wound is superficial. Regular vaccination against tetanus was received 3 months ago. What treatment tactics would be the most advisable in this case? So we discussed that rabies. Rabies, it belongs to the rhabdovirus. It is the rhabdovirus. Now rhabdovirus, we discussed that is the helical shaped. It is the helical capsid structures and bullet shaped virus. It is the bullet shaped virus that we discussed. Bullet shaped virus. Now rhabdovirus, it is what? It is the RNA virus. It is the RNA virus. Okay, I am writing it here. Rabies or the rabies rhabdovirus. Rhabdovirus. It is what? It is the helical capsid, and it is the bullet shaped virus. It is the bullet shaped virus. It is transmitted by bats, rabbits, raccoons or stray dogs. So it can be transmitted by the bats, rabbits, raccoons or the dogs. Also remember, when we talk about the rhabdovirus, remember that it involves the nicotinic acetylcholine receptors. And due to which it caused the retrograde migration. So that you need to remember, which migration is shown by the rabies virus, that is the retrograde migrations. Which migration? Retrograde migrations. And this retrograde migrations to the brain. And we know that in the brain we having one pathognomic body. Which pathognomic body we having? That is, yes, that one is the Negri body. That is the Negri bodies. Can you tell me other clinical features that we seen in this rabies? Yes, these patients will be having the hydrophobia. These patients will be having the photophobia, and also there can be the paralysis can also be there. These things all already we discussed in our surgery classes. So that we already discussed. Rhabdovirus, bullet shape, transmitted by the bats. The things that we did not study about the prophylaxis. The post-exposure prophylaxis, we studied that once it is bitten by the any bat or any dogs, so first we need to wash that at least minimum 15 minutes with the soaps. Now if we take the prophylaxis, now this prophylaxis we can take pre-exposure also and post-exposure also. If we are doing the pre-exposure, so in the case of the pre-exposure, what we will do, we will provide just a vaccine. Just a vaccine if if there is a risk of the dogs. Then if we having the post-exposure prophylaxis. In post-exposure prophylaxis, what we will do, we will check if the vaccine is already done or not. If rabies vaccine history, like he already take the rabies vaccine, so in that patients we will give only the rabies vaccines. In that patients we will give only the rabies vaccine at the post-exposures. If person is not sure about vaccine, if not sure, like he did not take the vaccine, and not sure, so in that case what we will do, we will give the patients rabies vaccine. Along with that we will give the immunoglobulins. If he already take the vaccine, so only then at that times we will give only the rabies vaccine. But if he is not sure about the vaccine or he didn't take any vaccine in the past, so in that condition what we will do, we gave him the rabies vaccine, along with that the immunoglobulin. And this immunoglobulin, it will provide the active immunizations. What it will provide? It will provide the active immunizations to that patients. That's why we will give to the immunoglobulins. Okay, that you need to remember. And the prophylaxis, again, that is a very important point, so remember this point. So in this condition, the regular vaccine against tetanus was received 3 months ago. So already vaccine has already been done 3 months ago. So in that cases, we will give the anti-rabies vaccination only. In option, they can give you anti-rabies vaccine and immunoglobulins, anti-rabies immunoglobulins, anti-rabies vaccination. For example, these both options, and third option they can give anti-rabies vaccine plus immunoglobulin. So these options can be there as well. After that, question number 27. 27 and 26-year-old woman is suspected to suffer from the SLE. So we having the SLE here, and SLE, I hope every one of you know that we having the LE cells and they have the antibodies to the double-stranded DNA. Wassermann reaction is positive, immune complex because it is the type 3 hypersensitivity. It is the type 3 hypersensitivity. This we discussed in rheumatology class, and you can also check the video also on this. What immunological indicators are considered to be specific to this disease? So that is, what will be the answer? That is the double-stranded DNA antibodies. I think they are already given in the option also, and so the double-stranded DNA antibodies will be seen in these conditions. Along with that, what we discussed, that there can be the anti-Smith antibody also present. Anti-Smith antibody also present, can be seen. And the SLE is what? It is the type 3 hypersensitivity, immune complex deposition. We discussed this topic in detail. After that, a group of 5 had resulting in a forest. They were drinking alcohol, eating canned mushroom. So remember the keyword for the KROK exams. So if you are getting the any canned food and canned mushroom, canned fish, so remember that in that condition, most probably 99% the answer will be the botulisms. The next state of them, but firstly read the full all the questions and then answer. Then remember that with disturbed vision, swallowing and respiration, the third one presented with acute general weakness and the dry mouth. Remaining two were healthy. A tick was detected on the skin of one of the healthy group member. What is the most likely diagnosis? So we will be having the Clostridium botulisms. The Clostridium botulisms. And the Clostridium botulism, remember that it is the gram positive. I think this again we discussed. Gram positive, it is the anaerobic bacteria and it is the spore forming bacteria. It is the gram positive anaerobic spore forming bacteria. What it cause? It block the calcium channels. What it cause? It block the calcium channels. And due to which, if it will block the calcium channels, because it release the botulinum toxins, and this toxin will act on the synapse between the two neurons, and at that times it will block the calcium channels, due to which there will be the no release of acetylcholine. There will be no release of acetylcholine will be seen. If no acetylcholine will be released, so we know that acetylcholine is the parasympathetic neurotransmitter. So we will see there is a no muscles movement will be seen. There will be no muscles movement will be seen, and in that cases we can see these patients can having the flaccid paralysis, and the flaccid we discussed, that is the peripheral paralysis. The peripheral paralysis can be theirs. And these problems in the swallowings, because all the parasympathetic symptoms will becomes, and the diplopia can also be seen, like the double visions can also be seen. Okay, so this is what, that is the botulinum toxins. So there is a swallowing problems, disturbed visions will be there, the weakness and the dry mouth will be there because of parasympathetic problems. A tick was detected one of the healthy group members. What is the most likely diagnosis? So these all are the botulinum toxins, like the symptoms of the botulinum toxins that we will see in these patients. Okay, see, firstly it is the gram positive bacteria, and gram positive bacteria, if you like little bit about in details, we know that we discussed that the gram positive bacteria, what they cause, they release the exotoxins, and this exotoxin, that is the botulinum toxins, what it will cause, it is present in honey or canned food or the canned foods. So if for the long times, if you are consuming for the long times, it can cause the respiratory arrest. It can cause the respiratory arrest. That's why the botulinum toxin is very harmful toxins. Okay, for the treatment, what we do, anti-botulinum serums and antibiotics like streptomycins we can give. After that, Question number 29. A 23-year-old man complained of the facial edema. So we seen the there is a facial edema, headache is there, dizziness is there, low urinary output, and urine discoloration, dark red. These complaints arose after the patient had a case of the acute tonsillitis. So we have seen that dizziness, low urine output, dark, the complaints after the patient had the case of the acute tonsillitis. So this patient has been diagnosed with the acute tonsillitis. On examination, there is the facial edema, the skin is pale, the temperature is 37, the heart rate is, blood pressure is this, heart pulse, the second heart accentuated over the aorta. What etiological factor in this? So we discussed the rheumatic heart disease. In that we discuss the acute tonsillitis. The persons will present with the acute tonsillitis. It can lead to the acute tonsillitis or pharyngitis. So it is caused by the beta hemolytic streptococcus. Acute tonsillitis or pharyngitis. What are the etiological organisms? That is the beta hemolytic streptococcus. That is the beta hemolytic streptococcus will be there. So what they do? The tonsillitis, pharyngitis. If you not treat these conditions, we discuss all the prophylaxis and everything in the rheumatic heart disease. I will post the video of the rheumatic heart disease also, so that you will be able to learn again, revise again. Tonsillitis or pharyngitis. If you not able to treat, so after some week, what they cause? They cause the molecular mimicry. What they cause? They cause the molecular mimicry. And in the which protein they mimic? The M protein. They mimic the M proteins. And this M protein, M protein formations. This M protein that will be accumulated in the joints. That will cause the rheumatisms, and it can also cause the scarlet fever. Then it can also cause the rheumatic heart disease. It can also cause the rheumatic fever. So all these things that is associated with the group A beta hemolytic streptococcus. Okay. So this M protein, what it will deposit in the joints. This M protein will deposit in the joints. It will cause the rheumatisms. It will cause the rheumatisms. If this M protein will deposit in case of the there like fever, we discuss the fever like scarlet fevers. That is the scarlet fevers. If any antigens problem is there or in the scarlet fever, then it can be deposited in the heart. In the heart it will deposit. It causes the rheumatic heart disease. And if it is deposited in case of the kidney, so it can cause the post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis. Also, it can cause which conditions? Rheumatic fever. It can also cause the rheumatic fevers. And the rheumatic fever, what we discussed, that it contains which body? S of bodies. S of bodies will be seen in rheumatic fevers. Okay, so that you need to remember. The tonsillitis, pharyngitis, all it is caused by the beta hemolytic streptococcus. This is the easiest question that you have. After that, during examination, a 4-month-old child with the meningococcemia present with the acrocyanosis, cold extremities, tachypnea and thready pulse. Blood pressure of 30/0. So we have seen that there is a decrease in the blood pressures and there is an increase in what? Heart rate. The increase in the blood pressure, there is a tachypnea, the tachycardia, all this we discussed. That is the case of the shock. That we seen in case of the shock. Now we having here the meningococcemia. So which kind of the shock we will see in this condition? That is the septic shock. Along with that, we discussed these topics again in the details, where we discussed the meningitis. In meningitis, we discussed that there we having the, it can be the bacterial meningitis. Here we having the which organisms? Neisseria meningitis, the gram-negative bacteria. It can be the viral meningitis. In the viral meningitis, the glucose level will be same. In the bacterial meningitis, the glucose level will be decreased. It can be the meningitis due to tuberculosis. So in the tuberculosis, what we will see, there is a more lymphocyte and glucose level will also be decreased. So we already discussed these topics, and there was one table also there we discussed. Okay. In case of the soak, like if any bacterial infection is there, so in condition we have the more neutrophils will be seen. But if you see that there is any decreased blood pressures or increased heart rate or the tachypnea, all these are the symptoms of the soak. Now the pregnancy is the full terms. The body weight, what is the term baby? That is 37 week to 41 week plus 6 days. That is the term baby. The body weight of the parturient woman is 62 kg. Fetus is in the longitudinal lie. The fetus is the lie we discussed. The fetus is in the longitudinal lie. The head is engaged to the pelvic inlet. Blood, belly circumference, uterus fundus. What body weight of the fetus can be expected? So see in this question, I think we discussed, yeah, let's come back. And so in this question, what will be this type of the questions we already discussed. So what we have to do, the body weight of the fetus. So for body weight of the fetus, what you need to calculate? The body weight of the fetus, that will be equals to 35 multiply 100. So it will be 3500 grams. So you need to belly circumference and uterus fundus height. You need to multiply these amounts, so it will be in the gram because both are in the centimeters. And after that, if you will want to calculate in the kg, so it will be 3.5 kilograms. Okay, so that will be the answer. So if you want to calculate the body weight of the fetus, in which they have to given the body circumference along with the uterus fundus height. So this will discuss the body circumference multiply, that is the fundal height. So that will give you the body weight of the fetus. I think there was a one questions also there we discussed in the pediatrics the formula or all those things. So revise that things again. Then after that, an 18-year-old young man complains of the pain in his knee and elbow joints and body temperature 39.1 week and half earlier developed sore throat. On examination of body temperature 38.5 degrees Celsius, swelling of the knee and elbow joint is observed. After that we see the pulse is 106 and the rhythmic blood pressure is 90. The cardiac apex there is systolic murmur. What factor would be the most indicative of like the etiology? So this again we discussed, that is the anti-streptolysin O antibody that we will see in these conditions, because this condition we discussed that is the like in the case of the scarlet fever, and we discussed that there is a group B beta hemolytic, group A beta hemolytic streptococcus bacteria, and group A beta hemolytic streptococcus bacteria, but we will study which antibody, that is the anti-streptolysin O antibody will be there. Okay, I am not discussing any topic here because we already discussed these topics before. This question we discussed there, just now we discussed the tuberculosis meningitis. So revise the meningitis topics and solve this question. A 32-year-old woman complains of increasing the spastic pain in her lower abdomen that occur after the emotional stress. Bowel movements are intermittent, 2 to 3 defecation after walking in the morning, alternative with the constipation that lasts for 1 to 2 days. Objectively, body mass is retained. Retromanoscopy is painful due to spastic condition intestine. Intestinal mucosa is amount of the fecus. What is the most likely diagnosis in this case? So this question I think we did not discuss, the irritable bowel syndromes. Did we discuss it? Yeah, we did not discuss it. So let's discuss this topic in the details. Irritable bowel syndromes. So this irritable bowel syndromes, what remember that it is a common disorder that involves the stomach and intestines. It involves the stomach and intestines. What are the symptoms or the clinical features you will see in these conditions? That is, like you will see there is a cramping will be there. Along with the cramping, what you will see, the abdominal pain will be there, and along with the abdominal pain, bloating, gas and diarrhea, constipations, all these things, all these clinical features you will see in these conditions. These irritable bowel syndromes, it is what? It is the chronic conditions. It is the chronic conditions. Okay, that you need to remember. So this, whenever you see their patient with the irritable bowel syndromes, so these patients will be coming with the abdominal pain, the cramping, they will see there is a bloating also in the intestines, the bloatings, and along with that you see the changes in the appearance of the bowel movement, changes in the appearance of the bowel movement. Along with that you see there will be the sensation of the incomplete evacuation, and there will be the bloating, the bloating we already wrote it here, the gas and the diarrhea. So these kind of the features you will see in this condition. What are the cause? If you study what is the cause of irritable bowel syndromes, the cause, remember that if it is mainly due to, like, if muscles contraction in the intestines, that involves in irritable bowel syndromes. So the wall of the intestines, these are lined with the some layer of the muscles that will contract as the moves, that the food will moves through the digestive tract. So these muscles will contract. Now once, in case of the irritable bowel syndromes, this is the usual findings, like whenever the food will be go down, so these muscles will contract so that food can go down. But in case of the irritable bowel syndrome, what we see, these contractions are the stronger contractions and it will be for long times. So what they will cause? They will cause the gas, bloating or the diarrhea like of the symptoms. If we having the weak contractions, that can cause the slow food passage, and that will lead to the hard and the dry stools, that can lead to the constipations. That's why we wrote here that it can cause the diarrhea also, or it can cause the constipation as well. Okay, it is also associated with the nervous systems. If we see the poor coordinated signals between the brains and the intestines, so it will cause our body to overreact to the changes. Like if whatever the changes that is occurring in our digestive process, like that will be poorly coordinated signals, and that is caused by the nervous systems. Okay, that you need to, and it is, remember that it is having some trigger factors like the food. Along with the foods, we can having the stress. The stress can also be a leading factor of the irritable bowel syndromes. So in this condition, we see there is a complaints of the increasing the spastic pain. There is a increasing spastic pain. So more contractions that will cause the pain in lower abdomen that occur after the emotional stress. So we discussed that is the trigger factors like food, the stress. So they can be the triggered factor. The bowel movement are intermittent, 2 to 3 defecation after walking in the morning. With the constipations, objectively body mass is retained. Palpation of sigmoid cord moderately painful. The intestines will be the painfuls. Along with that, we discussed that there is a rectomanoscopy, like we have checked the rectum, and it is painful due to spastic condition of the intestine. If you are seeing there is a spasm, more contraction is there, so it means that is talking about the irritable bowel syndromes. Okay, so this is what that is the irritable bowel syndromes. Okay, the question number 35 is hygiene topics that we will discuss in the hygiene. The question number 36. A 37-year-old worker during the fire ended up in the area of high carbon monoxide concentrations. He was delivered to hospital in unconscious state. The skin of his face and hands is crimson, like the crimson means red. Respiration rate is 20, ECG 1 specific hypoxic myocardium. Hourly diuresis, the color index is this. Carboxyhemoglobin, what criteria allow the determining the severity of the patient's conditions. So this is what, that is the high carbon dioxide concentrations. So if the patients in the high carbon dioxide concentration, that will be the, that we will see, that is due to carboxyhemoglobin. When the hemoglobins combine with the carbon dioxide, what will form? It will form the carboxyhemoglobins. Okay, it can be the, in the question they can give you the high carbon dioxide concentration, or they can give you the smoking area, or the vehicles fuel. So these all are the keywords where you will see there is a loads of the carbon dioxide. So the vehicles, like when the vehicles will move, so there will be the burning gas will be formed, and this burning gas will release the carbon dioxide, and that will form the, yes, carboxyhemoglobins. Okay. Okay, tell me, if you having the hemoglobin plus we having the carbon dioxide, what it will make? It will form the carb amino hemoglobins. It we call this as the carb amino hemoglobins. So whenever the more oxygens will be there, these conditions will be reversed. If you are having the hemoglobin plus carbon monoxide, so we call this condition as the carboxy. We call this condition as the carboxyhemoglobin concentrations, and this is the more stable than hemoglobin oxygens, more stable than hemoglobin oxygens. That's why these patients can having lead to the death in these conditions. Okay. After that, question number 37. The question number 37 is saying the Abs palsy, the superior proximal times. Lots of the times we discuss this question. So in the Abs palsy, what we will be having is the adduction, extension, and the pronation. So arms will be adducted, elbow will be extended, forearm will be pronated. Okay. C5, C6 spinal nerves will be problems. Then question number 38, in the April during the medical examination, various population groups, 27% of individuals presented with the low working ability and the rapid fatigability. Now we see that there is a swollen friable gingiva that bleeds when pressed. So if you see this line, there is a gingiva is there and the swollen gingiva is there, that is due to or hyperkeratosis follicularis and skin dryness. So this is the due to deficiency of the vitamin C. This is due to deficiency of the vitamin C. Hypovitaminosis C will be there. Okay. This again done stenosis, laryngotracheobronchitis. It can be the other name of this condition is the, yes, croup, caused by the para-influenza virus. So it is the URTI, and what we see, the difficult inspiration, intercostal retraction, barking cough will be there on the second half, what we call stenosis laryngotracheitis. Then after that, question number 40, and the question number 40. The kind of the pain attack has never been detected in the patient before. The plain abdominal X-ray reveal no pathological shadow. Ultrasound detect. See, in ultrasound what we have seen, hyperechogenic mass. Hyperechogenic mass means, meaning of hyperechogenic means whitish, more whitish will be there. So more whitish substance will be there, that is the stones. So stone will be looks like the hyperechogenic or the more whitish in the ultrasounds, which reflect the sound waves in the enlarged right renal pelvis. So what diagnosis is the most likely? So that is the, and there will be the severe pain that is never been detected in the patient before. That condition is the renal calculus. Okay. See, if you see there is a pain in lumbar area. If you see there is a pain in the lumbar area, we call this as the lumbalgia, or we see along with that costo-vertebral angle tenderness, or we call this sign as the, if the costo-vertebral angle tenderness, we call this sign as the Pasternetsky sign, and if this sign will be positive, so we call these conditions that this is seen in case of the kidney stone. And we know that Pasternetsky sign where we studied, yes, that is right, that is acute pyelonephritis. So in both these conditions we discussed these, that there is a Pasternetsky sign and the kidney stones will be there. And in the kidney stones what we studied, that there can be the colicky pain will be there. Along with that we see there is a fresh RBC in urine. What we see? The fresh RBC in urines. And on ultrasound what we see? Hyperechogenics. Ultrasound what we see? Hyperechogenic. Can you tell me in the pyelonephritis which cells will be there? Yes, the leukocyte WBC will be seen in the urines. And acute pyelonephritis, it is most common cause is the E. coli. The most common cause is the E. coli. Okay, so that you need to remember. A 60-year-old complained of the unbearable pain right subcostal area. So there is a right subcostal area. She had history of acute pancreatitis. Okay, the temperature is this, sclera icteric, no sign of peritoneal irritation. Oatner and the Gubber greatest signs. Symptoms are Gubber, kitne aadmi the. So that is positive. That is the positive. Urine diastase. So diastase we discussed, that is this is the seen in chronic pancreatitis. And what is the most likely diagnosis? So this is complicated to the chronic pancreatitis. In acute pancreatitis what we discussed, that there will be the which sign? The Gray Turner signs, and we discussed that there can be the Gray Turner sign. The Gray Turner sign, if you see there is a pain in epigastriums, there will be the pain in epigastriums. Along with the Gray Turner signs we discussed that there can be the the pain in epigastrium, and this pain will be relieved when we will lean forward. Relieved when lean forwards. Relieved when lean forwards. So this is the very important keywords that you need to remember. So if you see there is a pain in epigastriums, that will be relieved when we lean forward. So that is the Gray Turner sign. Along with that we see there can be the Cullen signs will be there. The Cullen signs will also be present. Okay. Then we will be having, in case of the chronic conditions, the chronic conditions, remember, in case of the chronic conditions, just a second. Okay, let me write it here. In case of the chronic conditions, if you having the chronic conditions, always remember, if you having the chronic, in the chronic we see there is a signs, that is the Oatner signs. The Oatner signs. See this, we already discussed the acute and chronic pancreatitis. So you go to the pancreatitis topics and revise that topics. And along with that we see there is a Gubber greatest symptoms. Gubber. तो गब्बर आया तो गब्बर क्या करेगा गब्बर amylase को बढ़ा देगा. Amylase will increase. The amylase will increase. So they will cause the steatorrhea. After that the lipase will also increase, and trypsin will also increase. That is the Gubber greatest symptoms will be positives. Okay, this is the seen in the chronics. If it is the case of the pancreatic cancer, if it is the case of pancreatic cancer, if it is the case of pancreatic cancer, in case of the pancreatic cancer, remember what will be seen in case of the pancreatic cancer? Yes, you are right. That is the which sign? Core Vicier sign. Core Vicier sign will be positives. The core Vicier signs will be positives. Okay, and along with that we see there is a gallbladder obstructions will be there. The gallbladder obstructions will also seen in pancreatic cancer. That's why we will see there will be the jaundice, and this is the painless condition. This is the painless conditions that we will see. Okay, so remember these things. And for other, revise the other like whole topic about the pancreatitis that we discussed, and your questions will be solved. After that, question number 42. So there are the two questions. In one option they give you the answer, the central lung cancer. In another one they will give you the peripheral lung cancer. So a 64-year-old complained of the cough with expectoration consisting bloody streaked mucus. So we have seen bloody streaked mucus, dyspnea, low-grade fever, general fatigue. Presenting with these symptoms for the 3 months, he has been smoking since early adolescence. Objectively, we see there is a respiration 36, pulse is this. The right side of the thorax lags behind in the respiratory process, dull percussion sound and acute decrease of breathing activity are observed. X-ray shows homogeneous shadow of the lungs field. The X-ray shows the homogeneous shadow of the lungs field on the right with the mediastinum displacement toward the affected sides. What is the most likely diagnosis? So there are the two conditions. One is the central lung cancer and another one is the peripheral lung cancer. So let's differentiate the both the things. So it was the question number 42. So we have seen the central lung cancer and peripheral lung cancer. Watch this video at 1.5x or 1.8x to save the times. Okay, so that because I think I'm not speaking too fast, so that will be easy and you can make the notes in that also. Central lung cancer means the cancer that is present near the lungs root. Cancer near the lungs roots, and it is seen mainly in the smokers. It is mainly in the smokers peoples. It is mainly the squamous cell carcinoma. It is what? The squamous cell carcinoma. Squamous cell carcinoma will be there. And also remember that if we take the squamous cell carcinoma, what other features we will see in this condition? So there will be the hypercalcemia will be there. Hypercalcemia will be there, means calcium will be increased. And these patients will be having, there will be the small cell carcinoma. The small cell carcinoma, and they have associated with the small cell carcinoma is also known as the oat cell carcinoma. It is also known as the oat cell carcinoma. In case of the peripheral lung cancer, remember, like if the cancer involves the bronchi, if cancer involves the bronchi and the bronchi and alveolar sac, bronchi and air sac. If cancer involves the bronchi and the air sacs, then remember that if we will be having the, it is seen in case of the both smokers and non-smokers. It is seen in both smokers and the non-smokers. And this condition, peripheral lung cancer, it is associated with the adenocarcinoma. The peripheral lung cancer, they are the adenocarcinoma. And what are the features you will see? The clubbing of the fingers. The clubbing of the fingers will be seen. Hypertrophic osteoarthropathy will be seen. Whenever we will get the time, so we will discuss all the lung cancer also in the details, because if any questions will comes, definitely you can able to do. Okay, but once we will complete the syllabus, and after that we will do these type of the things. Then large cell carcinoma, it is associated with the gynecomastia. This the example of the peripheral lung cancer, gynecomastia, and there will see the galactorrhea as well. There what we will see the galactorrhea as well. So these conditions, like if we having the X-ray shows the homogeneous shadow of the lungs field, right field, mediastinums. So here we having the blood streaked mucus, low grade fever and the general fatigue. This symptom for 3 months. He has been smoking from early adolescence. Respiration rate is given, blood pressure, the right side of the thorax lags behind in the respiratory process, dull percussions, acute decrease are observed there. So we can see that where we seeing the observations, right side of thorax lags behind in the respiratory, dull percussions and acute decrease of the breathing activity are observed there. there is a homogeneous side of the lungs on the right with the mediastinal displacement towards the affected side. If you have seen that the mediastinum displacement towards the affected side, so it means that it is presenting near the root value, it is presenting near the lungs roots. That's why we will call this condition as the central lungs cancer. If you see the homogeneous shadow sorry, along with that we see there is a mediastinum displacement, so mainly they are talking about the root lung cancer or the central lung cancer. Okay. For 4 days a 30 fair. Okay, leave this question because for this question I will teach you the GFR and all those things. There are lots of the question like similar questions, so we will discuss everything at the one frame. Okay, in this question, normally if you see the blood creatinine value, then if there is more, so in that conditions we do the hemodialysis. Okay, now read these questions and solve these questions. If you see this question I gave in the test also. Okay, so that is the joint space narrowing and the marginal osteophytes. So osteoarthritis or all these things, rheumatoid arthritis. If evening sickness is given in the question, that means that is the, or this is also available on the YouTube also. The evening sickness is there, then in evening sickness or the pain relieved by the rest. So this is the case of the osteoarthritis. In osteoarthritis we discussed that there is a joint space narrowing will be there, and the osteophytes, osteosclerosis, the chondrocytes. If morning stiffness is there, morning stiffness. So in the morning stiffness, remember what you will see, morning stiffness, this pain will be relieved by the exercise. So that is the morning stiffness, and here we see that there is a rheumatoid arthritis. This is seen in rheumatoid arthritis. There will be the bony lesions, and the bony lesions, or sometimes you will give the U-Sura formations. There is one keyword that the U-Sura formations can be there. Okay, that you need to remember. Question number 45. This is the easy one. A 52-year-old woman suffering from the 2 year from the dulls, exacerbation pain in the right subcostal area, occurring after high fat foods. So bitter taste in mouth in the morning, constipation, flatulence. There is a coating on the root of the tongue. The abdomen is moderately distended and painful in the area of the gallbladder projections. So this we discuss that what we will do. We will do the ultrasounds. See, these questions are the big, so don't worry about these questions, because like when you will see in the screen, when you will see on the screen, the questions will be like this. The question will be like this, and it will be completed in the one or the two lines. It will be like on the horizontal sides. It will be on the horizontal sides like this, and they will finish in the one or two lines. So it will be not big questions in the exam. For the student who is doing offline exams, definitely you will get this type of the paragraph, but believe me, these are not a big type of the question. They are the very easy questions. Just you need to pick up the main keywords or the main line that what the question wanted to say. That's it. Okay, in this question, like for this type of the questions, what you need to do, you need to check if you what changes can be. You need to write firstly read the last line. What changes can be expected in the bone marrow puncture material? Prevalence of megaloblast, increased number of sideroblasts, erythrocyte hyperplasia, presence of blast cell, presence of lymphoid cell. Now see, you already know all these options. If you have the prevalence of megaloblast, it will be the megaloblastic anemia. If it is the increased number of the sideroblasts, so there is a sideroblastic anemia. Other than that, they can give you vitamin B6 deficiency. Erythroid hyperplasia means something erythroid precursors will be increased. Presence of blast cell, we know that there is acute leukemia can be there. prevalence of the lymphoid tissues can be there, that can be associated with the lymphoma. So you know everything. Now you need to check which out of which is given in the option, which point is given in the questions. Now see, you studied here that you discussed already that there is a subichthyric sclera and the bright red fissure tongue. Okay, there is a bright red fissure tongue is there. Okay, then after that cannot palpate it, the blood erythrocyte is there, hemoglobin is there, color index 1.5. okay, it can be the macrocytes, definitely it will be the macrocytic anemia. So that's why we will be having the prevalence of the megaloblast. Okay, that's how you can easily do these questions. Okay, we discussed already the questions about the anemia, microcytic and megalocytic. Most of the questions we already done. Okay, now see, what is the most likely diagnosis among these listed? Trigeminal neuralgia, glossopharyngeal, temporofacial, maxillary. Now still if you don't know anything, still you didn't read the question itself, but still you know that which is the commonest disease. Which is the commonest disease in these questions, and there are many questions maybe you studied about only the trigeminal neuralgia. Okay, because there is the trigeminal neuralgia, and also we give the drugs also. The drug of the choice for this condition is the carbamazepine. So this can be the answer. Now see if you want to see the questions, let's see the questions. In the question they are saying कि if you having the complaint of the paroxysmal intolerable facial pain in the left within the attack that lasts for 1 to 2 attacks are provoked by chewing. Okay, pain at the exit point of the trigeminal nerves on the left, touching near the wing of the nose on the left induce new pain attack. What is the trigeminal nerves doing in the face? It is the sensory nerves with the tonic spasm in the facial nerve. What is the most likely diagnosis amongst? This is the trigeminal neuralgia or the trigeminal pains. Okay, so that's how you can easily make the questions. If you still don't know any of your questions or any questions that you don't know answers, still you can make the answers. Some questions there will be little bit confusing, but most of the questions that it will be like this. So definitely if you want to make the guesses also, so make the correct guess. At least you should having the probability of the 60% and the 40%. The 60% that should be in your mind, okay, I make the correct guess. See, if you having the face, we have the motor supply, and the face we having the sensory supply. The face we having the motor supply, and the face we having the sensory supply. And the sensory supply, like it responsible for the pain, the temperatures, and that is what, which one? Trigeminal nerve. That is the trigeminal nerve. Okay, and this trigeminal nerves we know that is the fifth. This is the fifth one. So it having the branch fifth one, the trigeminal branch 2 or branch 3. Okay, so this is what? Ophthalmic branch, this is the maxillary branch, and this is the mandibular branch. Okay, so if V2 and V3, if V2 and V2 is compressed, if it will compress, it can be like by any tumors or by any mass is there, so there will be the pain while chewing, the pain while the chewings, or pain while we do the brush, or pain while we do the brush. So at that times we see the pain, and this pain is known as the trigeminal neuralgia. We call this pain as the trigeminal neuralgia. And what is the treatment for this condition? The drug of the choice for this condition, the drug of the choice will be the carbamazepine. Carbamazepine will be the answer, that is the sodium channel blocker. Then if we talk about the motor supply, it is by the which nerve? That is the facial nerve. The motor supply is by which nerve? That is the facial nerves. And the facial nerves, if it will be damaged, these patients will lead to the Bell's palsy. This patient will be the lead to the Bell's palsy, and the treatment for these conditions will be the steroids. The treatment for these conditions will be the steroids. Okay, is that clear? Okay, that's so great. After that, we will be having the same question, the rheumatoid arthritis. So we have the juvenile rheumatoid arthritis, the reduced mobility of the joints in the mornings. Now the next question, the urine dark in stool is the, so what we have the most likely diagnosis. The most likely leptospira, viral. You know about the leptospira, you know the leptospira, we having the three triad, one we have the triad. What the triad we studied in the leptospira, we studied there is a jaundice, there will be the jaundice, then we studied there is a myalgia, the gastrocnemius muscles pain, and along with that we discussed that there will be the hematuria, or the kidney failure will be seen. So this we seen in case of the leptospirosis. Okay, so let's see, if the liver is enlarged, palpation of muscles, especially the gastrocnemius muscles is there, is painful. So this is patient having the myalgia. Along with that we discussed that these patients will be having the jaundice. So the icteric will be there. Along with that, lumbar spine is there on the gastrocnemius muscles. We need to check. We will see read the full questions. Then you see there is a related to the infect third day of the illness with complete headache, pain, lumbar spine, gastrocnemius muscles, fever, chills, object condition of the moderate severity, sclera icterix, pharynx is hyper, tongue is dry with a dry mouth cutting, liver is enlarged, swelling is not palpations, urine is dark in the color. Urine is dark in the color means that patient is having the redness. So that is means we having the hematuria type of the conditions, and that is the leptospira. Now you see the question, there is a nothing is given about these questions. So that's why we having the answer, that is leptospirosis. Okay, and it is transmitted by which urine? The rat urine, transmitted by the rat urines. Okay, infectious mononucleosis, it is caused by the Epstein-Barr virus. This question we already discussed, there is increased number of megakaryocyte and no platelet productions. No platelet production, increased number of megakaryocyte. So what is that? ITP, idiopathic thrombocytic purpura. This is what? Nephrotic syndrome. In the nephrotic syndrome, we can see that there is a hypercholesterol is there. There is a total proteins, daily urine protein is there, biochemicals. So I tell you the mnemonics also, the nephritic syndromes or the nephrotic syndromes. In nephrotic syndrome, we see the hematuria. In the nephrotic syndromes, we having the that the nephrotic syndrome, the protein will be more very high amounts. That's what we discussed. Mucoviscidosis, cystic fibrosis. After that, esophago. This question we again discussed, esophagogastroduodenoscopy, because in this question we see intensive rough or the spicy food, the sore eructation, the rough or spicy food or the sore eructation, heartburn is there. For that we need to do the gastroduodenoscopy. Question number 54. A 23-year-old patient had taken 1 gram of aspirin. So we have taken the 1 gram of aspirin to treat the acute respiratory infections. After that, he developed an asthmatic fit with the labored expiration that was arrested by the introduction of the aminophylline. The patient medical history is not bound with allergy. The patient has undergone the 2 surgery for nasal polyposis in the past. What diagnosis is the most likely diagnosis? Cystic fibrosis we done, है ना? So we call this as the Samter strides. We call this condition as the Samter strides. The Samter strides, what we will see? We see that there is a NSAID, or we can say the aspirin. The NSAID or the aspirin is there, and they cause the allergy. If this condition is there, along with that we see there is asthma will be there. Along with the asthma, we see the patient will be having the nasal polyposis. So this is what the Samter strides. This question is some type of the questions asked in the FMC also. The 1 gram of aspirin is there. So we having the aspirin and the 2 surgery for the nasal polyposis. So what diagnosis we will be having? That the aspirin induced asthma. So aspirin will cause the asthma and the nasal polyposis. That is makes the Samter strides. that makes the semtestrides. The NSAID aspirin, asthma, nasal polyposis, semtestrides. So here we see the blood traces in the urine, urinary painless and undisturbed. Macrohematuria had been observed for 3 days. Kidney cannot be palpated. The kidney cannot be palpated. Now what we see, suprapubic pain is area without alternations. We see the external genitally non-pathological. On rectal prostate non-enlarged, cytoscopy reveals no alternation. So what is the most likely diagnosis? So we call this condition as the renal carcinoma. So this renal carcinoma, we did not discuss it, and these topics we will discuss once we will doing the cancer things. Okay, so in the skins you see देखो, mostly, like if I say that in the case of the cancer you see the first things, in some of the cancer you see there is a weight loss. If you see the weight loss, that can be the involvement of cancer, like we discussed in case of the esophageal cancer. Along with that, you see the blood traces in the urine. Along, if any kidney problems or the urination type of the cancer is there, so in that condition you see there is a blood is coming in the urine. Along with that, this cancer type of the things, the most of the time they are the painless. The most of the times are the painless. Like as we discussed now before also, that in case of the in case of pancreatic cancer, that is also the painful condition. So here we see that there is a painless concern disturbs, and macrohematuria has been observed in these conditions. Kidney will not be palpated because it is completely destroyed with the cancers. Then there is suprapubic areas without alternations, means it is not involving the urinary bladder. So that is not the case of the bladder tuberculosis. It cannot be the varicocele. Varicocele we discussed what can be there. Necrotic papillitis, no, it's not necrotic papillitis. And dystopic kidney, there is an abnormal kidney. On rectal investigations, prostate is not enlarged. The prostate is not enlarged, painless, has normal structure. Cytoscopy revealed no alternations. So what is the most likely diagnosis? So it can be the renal carcinoma and the dystopic kidney. The dystopic kidney, I think that is the abnormal kidney, because this is the dystopic means I think this topic means it is malposition or the faulty. Yeah, that is the dystopic here means ectopic kidney, like the malposition of kidney. So that will not be the answers. The malposition of the kidney. So one answer we will be having, that is the renal carcinoma. So that is the painless condition. That is the painless conditions. Okay, and along with that we see the macrohematuria will be seen. Okay, solve this question because we discussed this question. We discussed this question, and you need to revise these questions. Whatever the things is possible, revise this. Because somebody had doubt before, so I think it will be good if you will do it. Here is the hyperpigmentation is there as the keywords, and along with that we discussed this adrenal insufficiency. Other options are either notes like related to this also, so that's why the adrenal insufficiency also the answer. Now this patient hepatitis in the kindergarten, so we having the viral hepatitis, where the viral hepatitis, and the viral hepatitis what we see, we have the ALT activity will be increased. The ALT activity will be increased in case of the viral hepatitis. Okay, I think no one have any doubt till now. See, whenever the viral hepatitis, so we what examination would be the most informative? So we do the LFT. In LFT, what we check? We check the liver functions test, we check the AST, and we check the ALT. The ALT means alanine transferase, and here we have the aspartate transferase. So this is the aspartate transferase, and this is alanine transferase. Okay, so if AST, So if AST, or we can say the SGOT, SGOT. So SGO, O means what we having, the alcohol. O means alcohol. So alcoholic liver disease. So this AST will be increased or SGOT will be increased in case of the alcoholic liver disease. In ALT, what we see, in ALT we see the SGPT level will be increased. The SGPT level will be increased, and these patients will be having the seen in fatty liver and viral hepatitis. This is seen in fatty liver and viral hepatitis. Okay, along with that, in LFT what we see there is a decrease in the albumin. There is a decrease in the albumin will be there. Along with that, we see there is a jaundice can be seen in this patient, and there will be the decrease in the hippuric acid in the urine will be seen in LFT. So if the patient, if the viral hepatitis is seen, so what we will see, the ALT level will be increased. If the hepatitis due to any alcoholic liver disease, so in that condition AST level will be increased. Okay, so I think that is enough for today. Revise till here, rest we will continue further on. So these questions till now you need to revise, and some questions there will be the new questions, and try to solve whatever the questions possible we discussed already. You need to finish those two questions, it will be better. And also like keep revising the questions on the test center website. And so bye bye, good night, take care, see you next class.